Among them, there are cases where submentoplasty is necessary. It could be the fat under the muscle, or sometimes part of the muscle is removed, and you can think of it as a procedure that tightens the muscle back. Hello, I'm Dr. Kyu-Sung Cho from AB Plastic Surgery Clinic. What we commonly know is that the fat under the chin is a concern for many people, especially with double chins, or there are actually many different surgical methods for those kinds of concerns. And among them, I'd like to explain about the surgery called submentoplasty. I will explain it briefly. When it comes to liposuction under the chin, it's usually done in a way that the scar isn't visible by making a small hole either under the ear or at the back of the head. A long cannula is inserted toward the chin area to suction out the fat, or if surgery feels a bit too burdensome, there are lifting procedures like Ulthera or Shrink that use various types of lasers to destroy the fat cells, or you can get fat dissolving injections as well. Among these, there are cases where submentoplasty is necessary, so I'll explain about that. The double chin muscle tightening surgery, submentoplasty, as the name suggests, is a procedure where the muscles in the double chin are tied together. It is called the platysma muscle, and the surgery literally involves tying and tightening this muscle. It's not simply a surgery where the muscle is just tied and tightened like this. You need to approach it a bit differently. Although the procedure is called double chin muscle tightening, in reality, a small incision is made, the muscle is gently lifted, and then the fat underneath the muscle, or sometimes a part of the muscle itself, is removed, and then the area is tightened again. That's how you can imagine this surgery. There are cases where simple liposuction or laser procedures alone are not enough. Let me explain what those cases are. For cases where muscle tightening is needed, the first is, of course, when the muscle has sagged. As you age, there's a medical term called turkey neck, where the muscle sags and protrudes like a turkey's neck. For those people, even just slightly tightening the muscle will help as the muscle band becomes more defined and tightened. The second case is when liposuction or laser treatment doesn't have much effect. So, what kind of case is that? When we typically pinch the skin under the chin, there are people whose skin can be pinched very thinly like this. In these cases, we consider that there is no subcutaneous fat. How do we measure this? Just think of a sandwich when you pinch it. There's the skin, then the fat, and then the fat and skin on the other side. So it gets pinched together like a sandwich, right? But if this thickness feels quite substantial when pinched, then we consider that there is a lot of subcutaneous fat in between. In these cases, simple liposuction or even laser treatments can be effective. But if the layer is thin and you still have a double chin, then it could be due to sagging muscles, or the fat beneath the muscles like grape cluster fat, which we estimate may be present in larger amounts. In these cases, simple liposuction or just laser treatment may not be as effective. That's how you can think about it. So regarding the difference between muscle tightening and liposuction, I briefly explained it earlier. But to put it simply, the biggest difference between liposuction and muscle tightening is that if you only do simple liposuction, you just make a small hole so there won't be any visible scars, and you can remove all the subcutaneous fat. However, because the muscle underneath is covering it, procedures like deep fat removal or muscle tightening are difficult to perform with just a simple hole. In these cases, for submentoplasty, the area where the double chin folds under the chin, or an area that isn't visible from the front, starting from as little as 2 centimeters to as much as about 3 to 3.5 centimeters incisions are made, then the muscle is lifted, and the deep fat located beneath the muscle, and in the case of men, not only the deep fat, but sometimes the muscle here is overly developed. So the procedure may also include reducing some of the muscle volume and then tightening the muscle. There can be such differences. For those who have undergone liposuction multiple times or lifting laser procedures but haven't seen much effect, considering submentoplasty might be a preferable option. Now, when it comes to this surgery, is it just about liposuction and submentoplasty? That's not the case. There are also various options in between, like thread lifting, which can be done as well. So depending on the case, if there isn't much deep fat but there's a lot of sagging skin, or if only the muscle is sagging and the deep fat doesn't seem to have much volume, in such cases, you can simply insert a thread like elasticum under the chin. That alone can also be helpful. So in such cases, there's no concern about having an incision site, and with various methods, you can address double chin or sagging skin on the neck. So for those concerns, it's best to visit the clinic and consult with a doctor. There may be concerns about whether things will revert after surgery, which is something people often worry about, but with normal daily activities or typical weight changes, that's actually not the case. The reason is because, as I mentioned earlier, submentoplasty is not simply a procedure that just ties the muscles. The muscle is slightly lifted and the deep fat is physically removed. And since the surgery also slightly reduces the muscle, you can think of it as semi-permanently removing the fat cells altogether. So unlike dieting, in the case of dieting, the number of fat cells stays the same, but their size gets smaller. In this case, as the name suggests, the surgery actually reduces the number of fat cells. Of course, if there are extreme weight changes, it could be difficult, but within a reasonable range of weight changes, there's actually less chance of recurrence and similar issues, and you can expect the results to be maintained semi-permanently. As for scarring, when performing submentoplasty, there are rare cases where skin excision is done, but in most cases, skin excision is not performed, so there isn't much tension on the area, and scarring is generally not a major concern. And from the front, it's naturally in a place that can't be seen, so in these cases, there's hardly any need to worry about recurrence, which makes me think this is a very good surgery that can be maintained well. Today, I explained the differences between submentoplasty and liposuction and compared the two procedures for you. In addition, I mentioned that there are other simple methods such as thread lifting and various other options available. If you're concerned about a double chin, I recommend that you carefully visit a clinic and consult with a doctor so that you can find the most suitable surgical method. I'm Dr. Kyu Sang Cho, AB Plastic Surgery. Thank you.